Alright, to start the newborn assessment, we start with vital signs. I'm going to start with the heart. We will listen to the apical pulse of the baby for a full minute. Alright, that's a full minute. Typically, a baby's pulse is 110 to 160 beats per minute when you listen apically. As far as respirations go, we listen to the lateral lung, so that I will go ahead and do that. And you would listen for a full minute with a typical 30 to 60 breath per minute time. For crying of a baby for a newborn, they should have a loud cry, that's typical, but it needs to be moderate in tone. As far as breathing, there should be a synchronization between the diaphragm and the abdomen. Anything else is considered abnormal. Blood pressure can be taken in the upper arm or thigh. It should be typically 70 to 50 over 45 to 30 millimeters of mercury. A baby's weight has a kind of a wide range at 2,500 to 4,000 grams. And then the length of the baby should be between 48 to 52 centimeters. Now when you're measuring a baby, you should make sure that they are as flexed as possible so you can get an accurate measurement. Posture of the baby laying down. The baby's hands should be flexed and clenched, and the neck should appear short. A typical newborn looks like they don't have a neck, which is consistent with most findings, and it's normal. As far as temperature, I'm going to simulate this with a pen, but we would take it axially. That temperature should be 36.5 to 37.2 degrees Celsius. The skin of this baby it's consistent with its genetic background. The skin should show no cyanosis. It should be warm and dry. There should be a little acrocyanosis on the hands and feet, a little bit of bluing, which is normal. No petechiae on the feet, and no erythema toxicum. There should be some vernix folds under the arms, and a little lanugo, which is a fine hair. As far as the texture goes for a baby's skin, it should be smooth and soft, a little bit flexible. There should be some peeling on the hands and feet. That's a typical finding. It's not always found though, which is normal. As far as the baby's skin turgor to test for dehydration, we would do that near the abdomen. It should retract quickly. There should be no tenting. Pigmentation should be clear. As far as the head goes, it obviously needs to be round, symmetric. It should move side to side and up and down without limitation. It can be soft. There should be shouldn't be any molding, no cephalohematoma, and it should be a fourth of the body size, which is typical for a normal newborn. As far as the circumference of the head, we would measure that from the occipital bone up to the brow bone. And the typical circumference of a newborn baby's head is 32 to 37 centimeters. Next, we'll go ahead and palpate the fontanelles. The anterior is kind of a diamond shape up here. It's 3 to 4 centimeters long and then about 2 to 3 centimeters wide. A little bit different is the posterior. It's more of a triangular shape on the back near the occipital bone, and it's smaller at 1 to 2 centimeters. These both should be flat, and no bulging or sinking should be present. As far as the hair goes, it's just like the lanugo over the body. It should be fine. As far as the face goes, it should be symmetrical with movement. Eyebrows and eyelashes should be present in this baby. They are. That is a normal finding. The outer canthus should align with the ears. Any low set ears could indicate a genetic abnormality. As far as the nose goes, it should be midline. The nostrils should be equal in size, and the cheeks are full. There should be sucking pads present on the cheek. Lips are equal in midline, and the chin recedes, and facial grimacing should be present. As far as the eyes go, we can obviously measure accommodation with a pen light, which I'm going to simulate. The baby's eyes should respond to the light. The eyes should be bright, clear. There could be slight pseudostrabismus. Eye movement in all directions should be present. They could be a blue or gray color, which is a normal finding. There should be no discharge present, as there should be a tearless cry as well, because the lacrimal ducts have not fully matured in a newborn baby. As far as the eyelids go, these eyelids should be above the pupil, but they should be slightly within the iris of the eye. There should be no epicanthal folds. That could indicate a genetic abnormality. They should be parallel in plane of the face. The newborn, of course, should respond to bright light, and the cornea should be clear in the eye. The pupils should be equal in size. Eyelashes should be present, as I said before, and the cry should be tearless because of the underdeveloped lacrimal ducts. As far as the nose and mouth go, the nose should be flat and midline to the face. To test patency, you would use one index finger and then stick a thumb in the mouth and test each nostril to make sure that the baby is breathing and that the nasal structure is intact. The mouth should be symmetrical with movement. The lips should be pink. Cyanosis should not be present in the mouth at all. That is an abnormal finding. The sucking motion, when you stick an index finger in the baby's mouth, it should initiate a sucking motion, and then followed by swallowing. They should learn those. That usually typically happens about 36 to 37 weeks that they develop those reflexes, and they should be present when you're doing that. As far as inside the mouth, you should check for the hard palate and soft palate, make sure they're intact, there's no holes. That is basically the main thing is the cleft palate that we're looking for, and then the uvula should be midline and symmetrical. There should be no Epstein pearls present or natal teeth. The tongue should be free moving in the mouth, and it should be midline pink and moist. It could be a rough texture, and it's proportional for the size of the baby. And then we go to the ears. The ears should have no cysts, lesions, or nodules present. They should be parallel with the outer canthus on the eye. As I said, lower set ears can indicate a genetic abnormality. And they should be alert to sound. So if I were to make a sound, they should be alert to sound, and they would have a reaction to that noise. The neck, like we said before, was short. It should be straight and have folds. There should be no webbing present. Again, genetic abnormality. Or masses. Clavicles should be aligned, straight and intact. It's important to check the clavicles because that is the main bone that's broken during a hard birth, and you would notice that by assessing the baby. The shoulders should be symmetric as well. As far as the chest goes, it should be circular. The circumference is taken under the scapula and across the nipple line. Should be about 31 centimeters, 1 to 2 centimeters less than the head of the baby. That's a typical finding. The chest should be wider than it is long, and the sternum is about 8 centimeters long when you measure. That's on average normal for a baby. There should be no intercostal retractions. That indicates respiratory distress, or a sign of that rather. And then if we're auscultating the breath sounds, we'll do the front and the back. Of course, you'd listen more in depth to the real newborn, but as far as that goes, there should be no signs and symptoms of respiratory distress. The bronchial breath sounds, that's above the sternum and between the scapula right here. They should be clear, the breast should be flat, and the nipples are about 5 centimeters in diameter. They should be symmetrical. 8 centimeters is the typical distance between the nipples on a newborn. And there should be no supernumerary nipples present. They're usually benign, but they shouldn't be present. It's an abnormal finding if they are. As far as the heart goes, we'll go ahead and auscultate the heart sounds. They should be regular in rhythm and rate. There should be an S1 and S2 sound heard. There should be no functional murmurs heard. Well, they can be heard. That's a normal finding, but there should be no thrills. As far as maximum point, then we'll move on to the pulses. The brachial arteries on each side should be equal, regular, and have a 2+ force, just like an adult. And then we would measure the femoral arteries down here. Of course, they should be 2+ regular strength bilaterally. And then as far as the cap refill on the fingers and toes, just like an adult, it should be less than 3 seconds. If we were to assess the abdomen, it should be rounded. There can be some protrusion in a newborn. That is a normal finding. There should be no blood vessels present on the abdomen or cyanosis. The umbilicus is kind of a whitish bluish color and does not protrude. You should indicate 2 arteries and 1 vein in that umbilicus. That is typical. There should be no bleeding present, and the healing should have begun to where it looks dry on that umbilicus. As far as bowel sounds go, we'll auscultate the right upper quadrant. And we'll auscultate those bowel sounds. Alright, as far as the palpating the inguinal area next, we'll go ahead and do that. There should be no bulging present or lymph nodes in this area. And then we can go ahead and percuss 4 centimeters above the bladder. During the first void, there could be mild odor, and that's within normal limits. And then if we were talking gender, if this was a female, the mons pubis skin color should be normal. The labia majora covers the labia minora and is symmetric and appropriate for gestational age. The urethral meatus and vaginal orifice should be visible. There should be no pseudo-menstruation or any discharge present. For a male, you would assess the penis, measure length 2 to 3 centimeters is typical for a newborn and 1 centimeter wide. The urinary orifice should be normal. The urethral meatus at the tip of the penis should not be inflamed. The foreskin should adhere to the glands, and the erectile tissue should be present. And then as far as rugae on the testes, that should be seen, and the testes should be formed and consistent with the gestational age, and about a size of 1 to 2 centimeters. There should be no hydrocele present. Now, if you flip the baby over, you have to test the patency of the anus. It should be symmetric. There should be no fissures or tears for it. And then as far as the extremities and trunk, there should be resistance when you try to straighten them and flexion short. The range of motion should be symmetrical. Full extension, leg folds are equal in length of legs. Alright. There should be no clubbing present on the feet. The feet should be aligned. Should be 5 fingers and 5 toes. It's consistent with a normal finding, of course. The arms should be equal in length and have bilateral movement. Good muscle tone. As I said, 10 fingers and 10 toes. As far as the spine goes, it should be flat and straight when prone and C-shaped. There should be no dimple at the base. As far as the gluteal folds go, they should be equal and symmetrical strength and movement in all extremities. Now we're going to go ahead and test the reflexes of the baby. So we're going to test the reflexes of the baby. We'll start with rooting. I'm going to draw the finger here, and the baby should go towards that side, as well as on this side. For the plantar reflex, the toes should curl, and then palmar, the fingers, should curl as well. If you do the Maro reflex, you make a loud noise. The baby will form a C with their hands. As far as the tonic neck goes, the baby should be supine, turn the neck to the side, and the extremities extend, and then the opposite side flexes. The Babinski reflex, you would stroke the underside of the foot, and the toes should flare. As far as stepping goes, you would have the baby like this, and then one foot should touch a flat surface. And the baby should do a motion to where she acts like she's walking. That's that reflex. Alright, and then as far as crawling goes, you would flip the baby over prone, and the baby should use her extremities and act as if she is crawling in the prone position.